That's my question, really, but I'll just see if we can dig a bit deeper. So the relationship between the healthcare service and social care, what do you think are the main reasons? Give me one, give me two. You've given me the sort of the disparity between, the power disparity. Why don't health and social care work better together? Because it's clearly a no-brainer, right? In your experience, your vast experience, why don't they work better together?
So you can't do a left shift unless you've met your elective waiting time targets. Completely understand that. I understand why, if you're in central government and you're trying to get waiting lists down, you don't let anybody do anything other than waiting lists. To quote a colleague, you've got people being waterboarded in the back of some room so that they meet their waiting lists, whilst you've got me saying, what are you doing about the left shift into neighbourhoods? I mean, that is the reality of politics, it's the reality of government, it's the reality of local government, it's the reality of life. And so occasionally what you do is you ask somebody, like me and others, to say, how do you find a way through it? So neither of those people are bad people. The people trying to get waiting lists down are good people trying to do the right thing, because there's loads of people that want the waiting list down. And the people trying to do the left shift are also good people. But actually, what I would say is that over time, you want to be able to do both. So I'm not sure that people set out to not get it right. We've seen enormous numbers of places where good practice gets you closer. But I would say quite often that good practice gets you to the co-location of teams in the same porter cabin, which is slightly different to those three teams doing one thing together, rather than one bit of the hospital doing one set of assessments for step down or discharge, another bit of the system chasing people out of the hospital as quickly as possible, God love them, what a job, in order to let people come through, and a third bit of the system being the local authority social care, which has its own rules, its own data sets and its own way of doing assessments. Sure. The good practice there is they're all in the same place and they're able to talk about the same patients and then members of the public in the same way.
I hear you. So reflecting back what you've said, basically, the deep and fundamental divide, I'm reflecting back what you said, really is around central government direction on where you put your money and where you put your emphasis and where you put your resources. And that at the moment is get your waiting list down, and it's very difficult to look at other things in the system while that's the emphasis. Is that a fair reflection?
I would say that the domination of the acute trusts and what it is they're trying to deal with, and remember, I don't want them not to exist.
We all need them when we get sick, yes.
I'm a member of the public, and therefore I'm very, very clear about the NHS. I'm very clear on how beloved it is and how needed it is, and how it actually has stood the test of time of something that we think will always be there. So I don't want to be overly negative.
I understand. We're all going to need we all will need the acute trust if we're sick. We don't want a public health doctor if we're having a heart attack. So, but in order to get to where we want to go, which I think is we want the NHS and social care to work together as we need them to work together, how do we fix that fundamental problem that you've just identified? Is it funding flows?
I think it will be a mixture of things, I think. And really this is the big question, one of the big questions that we are responsible for answering, and I'm probably not ready to completely give you the answer to that now. But I think the direction of travel for me definitely takes us to the route of kind of making it simpler for the public, things like multiple assessments. I think things like making it clearer to the public what is going on in their lives and what the difference is. I think that I'm very clear that, and colleagues in the Department of Health know this, that I am pushing very hard on neighbourhood health. I'm using the language of the NHS 10-year plan. I'm very keen that we look at what is a left shift and how social care is integrated into that in a different way. The other thing I just want to say, in answer to your first question, is when NHS colleagues talk about integration, they're largely talking about integrating themselves. It's not local authorities they're integrating with. It's really interesting when you say, you go along, you get the presentation, whether it's an integrated it's just very interesting. And also they use the word care. So a lot of healthcare uses the word care, but that isn't the care that allows me to get help to be fed so I don't choke, or it isn't the help that allows me to be showered or taken to the loo. Oh. And so I think that that's partly why we think that we need to reset the conversation with the public about what care and health is, because I think that and it's something, hope, Paulette, you don't mind me using your first name, but what you said about your 25 years as a nurse, I think you spoke for, the way you described it, a lot of people in the professions and a lot of the public who don't see the differences between these things and just want somebody to help them.
And I think that's a really good point. The fact that healthcare stands on its own as a system, beloved, as you say, and social care does not stand on its own as a system. It's integrated into arguably a very strange world, which doesn't really look like a social care world. Local authority looks like emptying bins and sorting out all sorts of problems. Social care is a very distinct problem from from the vast majority of other local authority issues. Is it therefore reasonable to say that social care, and there were reasons why social care was put into local authorities, is it fair to say that actually social care sitting in local authorities is part of the problem here, because social care is a different beast to local authorities?
Social care, that's so interesting. Maybe I'm just too old. I remember when social services in local government, the history of it when it was switched. Basically, local authorities are the public. They are closer to the public than any other institution. Councillors are the public represented, and they stand in a very different role. And I think it's become much harder for colleagues in local government, and I'm one of their worst critics and biggest allies, don't get me wrong, but I think that we ought to be a little careful of saying that health would do it any better.
Well, so I'm not saying it would do it any better, Baroness Casey. All I'm saying is that it has autonomy, and it has, you were talking about parity of esteem between health and social care, and we all know that local authorities, unfortunately, get kicked whenever anything goes wrong. Social care is incredibly important. It does need to have good, close relationships with health. Is that feasible, realistic, if social care remains in that local authority setting?
Yes, I think it is.
Okay.
I definitely think it is. And I also think that one ought to look at the voice of primary care as part of that. So I also think if you look at kind of what's happening around GPs, what's happening around neighbourhoods, what's happening around community health, I think that you would probably, if you were to ask them, they might also make the argument that they don't have parity with acute trusts as well. So I think the closer you get to the public and away from big buildings, essentially, I think that you're asking where I completely think I totally understand, and I think is when what local authorities then have to deal with when it comes particularly to adult, not children. So children's social care, remember, is fully funded and fully organised. Then what adult social care has to do is enter into this world of a huge financial assessment. So this idea of assessment is twofold for local authorities. One is they have to look at how much money we have, what our banks are doing, verifying it. It's a huge process. I'm not saying it's wrong, I'm just saying we forget to talk about that bit. And they have to do these assessments. And I suppose I feel parity is often about culture and about respect, and I think just a nudge in that direction is what I'm trying to do. I think colleagues in the NHS probably think it's a shove, but I'm attempting a nudge.
That's interesting, thank you.
Thank you very much. Andrew George.